When I first started working with people in pain, like many practitioners, I was very focused on the physical body. And to be clear, I still think the physical body matters enormously. Biomechanics matters, posture matters, movement quality matters, strength matters, tissue health matters, breathing mechanics matter. The way someone loads their joints, their spine, their muscles and connective tissues matters. I do not want this episode to sound as though I've moved away from the body. I have not. But what changed over the years was that I began to see that the body is not separate from the rest of the person. The musculoskeletal system does not live in isolation. It's influenced by the digestive system, it's influenced by the endocrine system, it's influenced by the immune system. It's influenced by sleep, hydration, blood sugar, emotional stress, trauma, belief systems, environment, and the person's sense of safety. So the question became, how can we possibly understand persistent pain if we only look at one layer? That does not mean we throw away biomechanics. It means we stop pretending biomechanics is the whole picture. And that is really where the book came from. It's a result of years of trying to make sense of what I was seeing in real people. People are not machines. They are living, breathing, feeling, adapting organisms. And pain is not simply an output from a damaged body part. It's an experience produced by the whole person. One of the most important shifts I hope the book helps people make is this. Pain is not simply a measure of damage. Pain is a protective experience. Now, that does not mean pain is imaginary. It doesn't mean it's not real. It doesn't mean it's all in your head. Pain is real. But the reason pain can be so confusing is that it's not a simple damage meter. You can have significant tissue changes on a scan and no pain, and you can have severe pain without obvious tissue damage. You can have pain that moves around, flares under stress, improves on holiday, worsens after poor sleep, or changes depending on what you believe is happening in your body. That tells us something very important. It tells us that pain is influenced by context. And if pain is influenced by context, then recovery has to involve more than chasing symptoms. We have to ask better questions. What is the body trying to protect against? What inputs are increasing threat? What systems are under strain? What patterns are keeping the nervous system on alert? What does this person need in order to feel safer, stronger, better nourished, better rested, and more able to move forwards? If this sparks something for you, there's a much deeper conversation in the full episode. You can watch it here on YouTube or on Spotify, or listen on Apple Podcasts. Like, subscribe, and stay connected for more.